Welcome back to our show. I've got a special guest with us today on the line. Our first international guest on Better Than Before, Julie Holden, is with us today. And she has an extensive background of over 25 years delivering benefit solutions to her clients in both the insurance and consulting industries. Julie was a principal at one of Canada's largest consulting firms, where she led its health and productivity practice in Ontario. Previously, she has led two of Canada's largest insurer disability claims operation, and she brings her frontline perspective to clients, as well as the right approach to the table, and delivers excellent customer service, and is a graduate of the University of Toronto's Ontario Institute for Studies in Education. She was a contributor to the 14th edition of the Handbook of Canadian Pension and Benefit Plans and is heavily sought after for speaking and writing engagements on topics relating to workplace health and productivity. And that's what I want to talk to Julie about today. Julie, welcome to Better Than Before.
Hi, Tony. Thank you so much for having me on. I really appreciate it.
Yes, and tell me once again where you live.
I'm in Oakville, Ontario, which is just outside of Toronto.
Okay, wonderful. Well, listen, I wanted to have you on because I want to talk to you about mental health in the workplace. And you are the expert, especially in Canada, on this subject. So how big a problem is workplace mental health, and why are we so concerned about it these days?
Yeah, well, it is a global issue. Certainly it's significant in Canada. I did a bit more research on the US, and the amount of money companies are spending on mental health is really increasing rapidly, and the annual costs are increasing twice as fast as all other medical expenses. I'll give you a number. It's quite staggering. Mental Health America conducted a study called Mind the Workplace, released the results in October of 2017, so last year. And in it, they estimate workplace mental health is costing employers $500 billion in lost productivity annually. So it's really a significant problem. A couple other just quick stats. Employees with mental illness submit up to 4 times as many medical claims. And people suffering with depression submit on average around $15,000 a year in claims, compared to almost $6,000 for the general population. So, there's a lot of information out there. There's a lot of statistics. I mean, I won't go on about all the statistics, but I mean, $500 billion in lost productivity just sort of says it all there. Willis Towers Watson, which I know is big consulting firm in the US, it's also big here. They just conducted a study, and in it, almost 60% of employers plan on making workplace mental health a priority over the next 3 years. Because they are seeing all of these increases, and they're seeing, people suffering at work. So they want to do the right thing, which is great.
Yeah, a lot of our clients buy a lot of Towers and Watson compensation. They provide a lot of really good data. And I've noticed over the last couple of years, one statistic that's alarming, and I can't quote the statistic, but there is an incredible rise of heart attacks at work. And so my question for you is, can we locate where all the stress is coming from in the workplace?
The leading causes are, they're sort of simple things, but they keep sort of getting away from us. They're things like workloads that are too high, inflexibility at the workplace. It could be somebody that needs to work, different hours or work from home, or just have different flexibility in the workplace, and sometimes it's not available to them. Lack of training on new systems and tools. And again, organizations, are trying to streamline and make things more efficient all the time. So they'll roll out a new system and they'll do some training. But unfortunately, a lot of employees feel that it's not enough and they get really stressed. It's just not working for them. So that causes a lot of stress. Not enough resources, again, with, right sizing or, downsizing, streamlining, all these different terms, all these things that organizations do to become more efficient and, get better financial results impacts employees in different ways. So they don't have enough resources sometimes. They've maybe cut out a role or two. And that plays on employees' stress.
So listening to some of your talks and reading some of your writings on the subject, how does stigma affect it?
Yes, there have been gains around stigma, but unfortunately, it's still a huge issue. Many employees report that they wouldn't tell a colleague or their manager if they were suffering, with a mental illness, which is too bad. They're concerned about what people will think of them, and they're concerned about how it might impact their job and their career. So they don't tell anyone. It also interferes with people getting treatment, because they're not disclosing to people. They're keeping it to themselves and trying to just sort of struggle through, which is really sad. 80% of people that go for treatment for mental illness actually recover. So if people can get the help they need, they can be healthy again and lead a productive life, including work.
I understand, about the stigma and worry and this, that, and the other. I suppose step one is recognizing I might have an issue. What are how do I know fairly quickly if I'm in that zone where I need some help?
Yeah, well, it's actually really good for employers to provide a health risk assessment tool for people to go online and answer a bunch of questions. I mean, there's ones that are specific to mental health. So, giving employees an opportunity to go in and answer questions and see how they're doing around their mental health is really good. So, some of the things they might feel, though, if you're an employee, is inability to concentrate, not getting your work done, like starting to miss deadlines when you used to be able to focus and, get a certain amount of work done in a day, and suddenly you're just not, just feeling high anxiety and nervousness, those kinds of things.
And so do people think sometimes? I mean, I know maybe the older generations might be more of this is just something I need to work through. Like this is just a phase. Maybe I'm just having a bad week or something like that. So they delay getting some treatment or help or something. They just try to work their way through it.
It is, and that's actually self-stigmatizing. We've got people stigmatizing us from the outside, but when we start thinking like that, we're actually self-stigmatizing, and it's again unfortunate because people can get better if they'll go for help. But yeah, it is. It's sort of that buck up, just get through it, pull your socks up type attitude, and it's not good for people. They don't get better, usually that way. They struggle through, and they don't feel well. We forget sometimes, like we're made up of physical health and mental health. And people in the workplace, employers have done a great job, especially in the last decade or so, working on physical programs for people. But we also want to help people with their mental health and educating them and giving them training around that. We want them to say, okay, no, actually, I'm not feeling very well. And it's okay. It's okay for me to talk to someone, and it's okay for me to go get help and maybe, have my work adjusted in a certain way and ask for an accommodation. It's all okay. And then I'll feel better.
So I'd like to introduce this topic to some of the CEOs and their executive teams that I coach. Help me here with the leadership's role regarding dealing with mental health with employees.
Yeah, that's a great question. The main thing leaders can do is really embed mental health into the culture, make it a business priority. It doesn't have to be a monumental initiative either, and organizations don't have to put a huge budget against it. They can build it over time. I mean, one of the simple things to start is just by sending a message to the staff about a commitment to workplace mental health. Also, leaders who share their own stories has a wonderful impact. When they start opening up, it's amazing what happens in a workplace. Having leaders trained at all levels on how to identify someone who's struggling at work and help them, like know how to identify it and then help them. These are all great first steps.
So aside from things from an initiative or a project type approach, what are some things that employers could do to maybe reduce the stress level in the workplace or help employees who might be showing signs of struggling with a mental health issue or a mental health illness? What are some practical type things they can do to help that?
Well, one of the first things I would do is conduct a survey of the employees around mental health in the workplace, because that will help to inform next steps. The survey it will get at things like stigma. It will identify what's really causing stress in their particular workplace, because before really what's causing them stress in your workplace, you don't know exactly what programs or policies you should implement or what things you should do. So some employers like to do an online knowledge survey. Others like to, depending on the workplace, whether it's spread out across the country or whether it's just in one place, they might want to do employee forums where they sit down and chat about it. One of the first steps really is to start the conversation, just to start talking about it so that people can understand that they can talk about it as well.
So if you think back over the clients that you've helped over the last few years, of course, without divulging identities or company names or anything like that, can you sort of give me an overview of a really strong success story? Somebody that you worked with where the situation was not good at all and they put some things in place and it really, really made things better for the employees?
Sure, yeah. Because it's so nice to talk about success stories. So I was working with an organization, a manufacturer, and they had a few different sites. They were experiencing a lot of turnover, reports of people talking about high stress situations, people leaving and going off on disability as well. So it was really impacting this organization's productivity. The first thing we did was the knowledge survey. This is something that I have that organizations like to utilize. So we did that in this situation. And through that, we were able to identify the top drivers of what was causing stress in the workplace and also identify some opportunities for training. So, so after the survey, we also communicated the results of the survey to the organization so that they could be involved and they could see what was, things were being done, and that they were being heard. Some of the things that came out of this survey were these opportunities for training, and also the people didn't feel recognized. It's very important for people to feel recognized for the work that they're doing. So in any event, we took this information and we put together some training modules. First for people managers and then for all employees, because we wanted everyone to have a good understanding of mental health and how it can impact the workplace and how employees can work with their employer, in this case the manufacturer, around what can be made better for them and how people can be accommodated at work. They reviewed workloads, they reviewed scheduling because scheduling was an issue. They did a lot of training with their people managers so that they could change some of their behaviors. A couple of different policies were put in place, like harassment policy and respect in the workplace policy. So these types of things. And we, have been working on this for a couple of years, and there's been a tremendous amount of growth. Things are turning around, and it's just a much better place for people to work today.
Yeah, you mentioned turnover, which is very expensive. You mentioned lower disability payouts. You mentioned some efficiencies and things like that. Are there any other advantages that employers can gain from taking action on this really important item?
Well, it really impacts health claims over time as well. I think I mentioned at the outset that, for example, someone with depression puts in on average almost $15,000 in claims, whereas someone in the general population who doesn't have a mental health issue or depression in particular puts in less than half of that, like almost $6,000. So over time, the health claims will come down as well. The expenses for absence, disabilities, health claims, turnover, a whole host of things. This is also casual absence, the people that are off a day here or a day there. I think I saw a statistic actually that folks have up to 21 days on average absence if they have a mental health issue in the U.S., which is huge. So all of these things combined really add up to a lot of money and a lot of lost productivity. So turning it around, of course, helps employers save on all of that. Workplace mental health is not only a financial cost, it's a legal risk. So it's a risk for litigation. And, things like here in Canada, we have human rights complaints. I'm not sure what it's called there, but probably something similar. All of these things is impacted by workplace mental health.
My special guest today is Julie Holden, and she has been educating us on workplace mental health and productivity. And Julie, I've got a couple of rapid fire questions to pitch at you that we use with every guest on the show. And so I'll pitch it to you and you answer off the top of your head. Are you ready?
Yes, I think so.
Okay. Number one question, best memory that immediately comes to mind for Julie.
Well, the best recent memory is a trip to Tofino on Vancouver Island this past summer. We rented a cottage and by the ocean, and our grown daughters that live out there, came and stayed with us. So it was absolutely wonderful.
Number one hero in your life.
Well, generally speaking, I don't know if I can pinpoint one, but people who go out of their way to help others, especially, vulnerable people. I really admire that.
Top value you subscribe to.
Well, integrity and honesty.
Most important person in your life.
That would be my husband, Alex. He works for a bank in Canada, outside of Toronto as well.
Do you and Alex have any children?
Yeah, we have grown kids. We have two daughters and one son.
I see. And do they have children?
Well, one does, yes. Granddaughter that's 12.
That's awesome.
I know.
So your favorite thing in the whole world?
It's going to sound funny, my espresso maker, because I love espresso in the morning.
What's your favorite food?
Well, I'm a foodie, so it's kind of hard. But I'd have to say Indian food. I just love the flavors and textures and, scents and everything, how it all combines, the flavors.
Most beautiful place you've ever been to?
That is hard. Cape Breton is absolutely stunning. And we were there this past summer as well. These are two places in Canada I do love outside of Canada as well. And I've been to the U.S., which is absolutely beautiful too. We were staying at a cottage up on a cliff overlooking the ocean in Cape Breton, and it was just beautiful.
If you could describe success in one word, what would that word be?
One word. Believe.
Okay. How do you want to be remembered?
As someone who's, I guess, kind and thoughtful, and someone who is trying to move forward the agenda on workplace mental health.
Advice for a younger Julie?
Be patient.
You weren't impatient when you were younger, were you?
Well,
certainly you've grown.
I have grown.
What's your favorite sound?
Our cat Gracie. I love it when she talks. She has her own vocabulary, and I love listening to her talk to us.
That's awesome. You only have the one pet?
Yes,
okay.
We do.
Gracie the cat. And finally, last question. What's the best lesson you've learned?
Well, it probably goes back to not being impatient. Not everyone sees the same things as important, or their timing may be different than mine. Everyone has different priorities. So I've learned to respect that and work with that. So that's been a good lesson for me. Not that I was extremely impatient. I was just, I would like to move forward with certain things. And sometimes, like I said, people are on different times and things like that.
Well, Julie, you are a dear friend. I hope we get to work on a project together someday. I really appreciate you being on the show. Tell everybody how to find you and how to contact you if they're interested in finding out more about this important subject.
Well, thanks, Tony, and I hope we do get a chance to work on a project. I'd love to. If they want to email me, I'm at julie@holdenassociatesconsulting.com. And if they want to check out my website, I'm at holdenassociatesconsulting.com. And my phone number is 647-455-2393.
Receive weekly coaching tips from Tony Richards, delivered straight to your inbox. Whether you're a CEO or an entrepreneur, Tony can help you reach your goals and give you a competitive edge within your industry. Tony's Monday morning coaching memo covers topics ranging from leadership development to teamwork to company culture and more. Text the word leadership to 38470 to sign up for Tony's Monday morning coaching memo, or sign up online at clearvisiondevelopment.com.